Yeah.
Andra Ofegu. Osage Oluwabusolami.
Good morning, Ma.
Good morning. This is Matron Mother and Child Hospital saying hello to you this Saturday morning. Thank you for being a part of this antenatal class. Many other people are still joining us. How are you? How is the pregnancy progressing?
Very fine, Ma.
Good. How are your husbands?
They are fine.
Okay, and all those who have other babies. I can see somebody there with a big tummy. Okay, that's good. We still have people who are joining us. Let's have them. Let them keep joining. I don't want any one of you to miss any part of this class. I can see Sonny Adeife. I can see Ojuederi Emilia. I can see Makina. I can see Linda. Let's keep coming. I think we have enough. I can see Nikki now. I can see Maki. I hope we enjoyed our last class about breastfeeding, and I think we have been also able to put into practice what we were taught. Hello?
It's my first time.
It's your first time. That's good. Did I see you at the clinic during the week?
No, Ma. I didn't get to see you.
Okay. Because I met some mothers to be during the week and ask if they have been linking up with our Zoom class. Some of them said they received the link, but they were not able to join. Okay, it's your first time. That's good. Thank you for joining us. I can see Ugualali, Kelechi. How is Mrs. Osage? How are you? Mrs. Osage, can you hear me? You can unmute yourself. Listen, let me unmute them so that I can listen.
Yes, good morning, Ma.
Okay, I can hear you, Osage. Yes. Good morning. How are you?
Good morning, Ma.
How are you doing?
Fine, thank you.
All right, good. Sonny, I've not heard you. Okay, Sonny, how are you? Sonny, they are muted. Sonny, how are you? Hello, Olamide Adedeji, how are you?
I'm fine.
Yeah,
good
good.
Morning.
Yeah, good morning. I can hear you. How's the family?
Very fine, thank you.
Okay. Chinyere, how are you? I can see you. Chinyere, how are you?
I'm very well, Ma. Good morning, Ma.
Good morning. How are you? How's your family?
Fine, thank you, Ma.
Okay, I think I see Anu Olapo. How are you?
Fine, thank you, Ma. Good morning.
Good morning. Henrietta, how are you doing? Henrietta? Okay, I can't hear. Talk by Ogunlana. I can see you. Talk by Ogunlana. How are you doing?
Good morning, ma'am. We're fine.
Good morning. How is your son?
Fine. Say hello.
Hello, David. How are you? Okay, good. Can anybody tell me something that you were able to do about the topic you had last antenatal class? Somebody to say something about the breast milk, breastfeeding? Anybody wants to say something? Hello? Anybody wants to say something about the about the breastfeeding class we had last week? I mean, the upper week. Okay. Okay. Osamegwe. Hello, how are you? Osamegwe. Okay, I'm not hearing him. I'm not hearing her. Okay, let's.
Hello, ma.
Hello, okay, she's talking. How are you?
I'm fine. Are you?
I'm good. Were you at the last antenatal class?
Not at all.
Okay.
I'm just in.
You're just okay. Are you joining us for the first time? Olamide, are you joining us for the first time? Oh, the name has come up. Okay. Okay. You are all welcome to another antenatal class. This is Mother and Child Hospital. And this morning, we are taking another topic, very, very important topic to mothers. And the topic is, postpartum hemorrhage. Postpartum hemorrhage. And let me share my screen with you so that you can follow.
Go and keep it. When you're hungry, later go and eat it. But you will have space to drink.
Can we see the screen?
Yes.
We can.
Yes, we can.
Yes, ma.
Good, we can see the screen. Okay. So I'm going to mute you all and I want you to listen. When you listen, you'll be able to get the good gist on the topic we are sharing this morning. Like I said again, the topic is postpartum hemorrhage. Postpartum hemorrhage is bleeding after the birth of a child, loss of blood, plenty blood after the birth of a baby. It can be more than 500 mils or up to a liter. And when it's getting up to a liter, it can begin to affect the blood pressure of the mother. The mother can go into shock and it can lead to death. Postpartum hemorrhage is a leading cause of mortality rates in pregnant women. So this morning we are going to discuss postpartum hemorrhage, the types of postpartum hemorrhage. We are going to talk about causes of postpartum hemorrhage. We are going to talk about its prevention. That is very, very important to you, the prevention of postpartum hemorrhage. And we are going to also discuss episiotomy and the care of episiotomy. Now we have said postpartum hemorrhage is bleeding after the birth of a baby. Lots of bleeding that could be up more than 500 mils to almost 1,000, and which is very, very dangerous to the mother. This bleeding, when it is much, it can cause drop in your blood pressure. It can lead to shock and eventual death. Like I said, it's a leading cause of death in pregnant women. The types of postpartum hemorrhage: we have primary cause, we have secondary cause. We have primary postpartum hemorrhage. We also have secondary postpartum hemorrhage. Primary postpartum hemorrhage is that hemorrhage, blood loss after delivery that happens within 24 hours after the delivery of your baby. And secondary postpartum hemorrhage is the bleeding, lots of bleeding that happens 24 hours after the delivery of your baby. Sometimes you might have gone home, you might have been discharged. And usually this type of bleeding is caused when your uterus is not properly contracted, or it relaxed, or you have some retained products in the womb. I mean, you are discharged and you are home and you just go to the toilet to wee and boom, you just saw blood. When you see this, you just go back to your hospital so that they can treat you. Now, we are going to look at the causes of postpartum hemorrhage. Lots of bleeding after delivery. We'll look at them under 4 T's. The first T has to do with the tone of the uterus. Your uterus that carries your baby, the tone, the muscular tone. Sometimes when the muscles of the uterus, when it's relaxed, when it cannot contract properly, it can cause postpartum hemorrhage, because those muscles are what compresses the blood vessels that nourishes the uterus, that helps to nurture your baby while the baby is inside. When the uterus is over distended as a result of multiple pregnancy, or as a result of several births, maybe you have 6, 7, 8 children, or you have 4, 5, you have twins, triplets, you have quadruplets, or you have 5 babies within the uterus. By the time the babies are born, the uterus, of course, would have been over distended, and this can cause postpartum hemorrhage. Sorry. Yes. Then we talk about trauma. The second T is trauma. When there is trauma, trauma means when the uterus is assaulted. Maybe the uterus is over, the contraction was so much that the uterus ruptured. You can also have trauma to the cervix. When the cervix is lacerated, we can have trauma to the walls of the vagina when they are lacerated, or when there is a ragged tear on the perineum. Those can lead to bleeding that may be so much and can cause postpartum hemorrhage. Then we have this third T is when tissue is involved. Sometimes when the uterus has discharged the baby and the placenta, there can be some retained placenta, parts of the placenta in the uterus. This can make the uterus to continue to bleed. Then this The fourth T has to do with the clotting factor, the thrombin, the clotting factor within the blood. When there is much bleeding, the clotting factor will be depleted. And when it is depleted, the body will not be able to maintain the mechanism of blood clotting in the body. And this can lead to DIC, which can be dangerous to the mother. Placenta abruptio is another cause of postpartum hemorrhage. In placenta abruptio, that is when the placenta begins to separate before the baby is born. It can happen when the baby is term, the pregnancy is term or almost term. And when this happens, when there is bleeding inside the womb, the clotting factor of the blood will be lost, and this can lead to postpartum hemorrhage. Placenta previa is another cause. In placenta previa, the placenta can be embedded in any part of the uterus, but when it is low-lying, it is called placenta previa. And it can be just be low-lying or very close to the cervix, the opening of the womb, the cervix, or it can even lie over the cervix. That is called type 3 placenta previa. The one that is close to the cervix is called type 2 placenta previa. The low lying is just placenta previa. And when, at the lower segment of the uterus, when they start, being taken up, the placenta can begin to separate. And when it starts separating, especially in placenta previa, you can have the first bleeding. You go to the hospital when you see bleeding, your doctor can put you on bed and say you should rest. The second bleeding is a warning. The third bleeding can give you a torrential bleeding, which can lead to a serious loss of clotting factor, and by the time the baby is born, you can have postpartum hemorrhage. Then we go to prevention of this postpartum hemorrhage. We have looked at the causes. We have looked at the types. Now, let's look at the prevention of postpartum hemorrhage, which is very, very important to us as mothers. When you come for your antenatal care, your caregiver will ask you a lot of questions. Want to know the history of your previous birth. Wants to know how many children you have. They want to know how the pregnancy was. They want to know how you deliver, whether you deliver by yourself, SVD, or you deliver by surgery, cesarean section. They want to know what happened after your delivery, and they want to know the size of your baby. All this will help your caregiver to know how to help you when you deliver, and thus prevent postpartum hemorrhage. When you tell them the number of children you have and the spaces in between them, you tell them how the pregnancy progressed, whether you had bleeding during the pregnancy, or during delivery, you had bleeding. Maybe you say, they told me that I bled after the delivery of my baby. It will help the caregiver to know what to do, how to prepare when you come in to deliver your next baby. So we encourage you not to hide any information that can help you during the delivery from your caregiver. We are here to help you. Another thing you can do to also prevent this postpartum hemorrhage is to use your antenatal drugs properly. All the blood-giving drugs that you are giving, take them properly to prevent anemia. When there is anemia, it prevents the uterus from contracting. You yourself, you will feel tired. And when you are, if you yourself can feel tired, you can imagine what can happen to the uterus when you have labored the uterus to deliver your baby. And when it's time for the uterus to now begin to work hard to prevent you from bleeding, it will be tired too. So take your blood medication while you are pregnant. Another thing we also do to prevent postpartum hemorrhage is when you go for scan, the scan will tell your caregiver the number of babies you have, will tell where the position of the baby is, and we also tell your caregiver where your placenta is situated, whether it is properly situated or it is low-lying. All this will help to prevent postpartum hemorrhage. Another thing we also look at is when you have a fall, you should report to your caregiver. You fall down over your tummy or somebody hits you on your tummy. This can cause abruptio placenta, can cause you, because you don't know where the placenta is. Maybe the trauma is coming on top of your placenta site or, wherever in the uterus. And this can cause your placenta to start to separate. But immediately you experience anything like that, you just report to your caregiver so that something can be done. Another thing we do also to prevent postpartum hemorrhage is when you come to the hospital, your caregiver will send you for routine examination, routine investigation. They will check your blood pressure. Sometimes some people, it is during pregnancy that they have hypertension. Hypertension also can cause postpartum hemorrhage. So when it is detected, immediate attention is given to it, and you can begin to receive treatment to bring your blood pressure to normalcy. Then during delivery, how to prevent postpartum hemorrhage. During delivery, the prevention of postpartum hemorrhage during delivery is solely in the hand of your caregiver. What we do is, after the delivery of your placenta, we make sure that your uterus is well contracted. We make sure that we look at your cervix and make sure there is no laceration. We make sure that if we have given you episiotomy or you have tear, we suture it quickly, and then we make sure that the placenta that is delivered is completed. So that brings us to the end of the types of postpartum hemorrhage, the causes, and how it can be prevented. Now we come to the episiotomy and the care of episiotomy. Episiotomy is the surgical cut made at the opening of the vagina during childbirth to create enough room for the descending head and prevent tear. Sometimes when your baby, especially those who have maybe premature babies, when they are going to be born, it is important to give episiotomy so that the baby, the fragile small baby's head is not, it does not have to be struggling with the passage to come out. But when episiotomy is given, the head of the baby will just glide out. But when we give this episiotomy, you also need to know how to care for this episiotomy. When we give episiotomy, we always, after the suturing, we tell you that you should not do sit bath. We tell you to avoid sit bath because some people, when they want to have their bath, the kind of water they use to have their bath can make gari. So we say, don't do sit bath. But on the other hand, when we look at the the comfort you receive when you do seat bath. We want to encourage you that if you are going to do seat bath at all, you should use tepid water. Tepid water with either salt or Savlon will help to ease the pain and the dryness you feel at the site of episiotomy. We also encourage you that to also have relief of pain from episiotomy. When you want to poo, make sure that you are not constipated, because when you are constipated, you are afraid to go to the toilet. But when you are not constipated, you can go to the toilet without any problem. So we encourage you to take plenty water, take roughage and a lot of fruits. When you take this, it will ease your poo and you will not have to struggle when you go to the toilet. When you finish pooing, you clean your under with tepid water also. When you clean with tepid water, you will now pat with dry towel or something soft so that the place can be kept dry. And then we also encourage you, when you have episiotomy, to sit on a hard surface. When you sit on a hard surface, it also helps to relieve the pain. When you sit on a surface that is too soft, it can, it will not make, you will not be sitting properly. You will even be standing, you will be sitting with your hand holding the seat. But when you sit on a hard surface, you'll be able to relax the muscle of your bum, and then the pain will be less. This brings us to the end of the topic of today, postpartum hemorrhage and episiotomy and the care of episiotomy. Mothers, the floor is yours now. You can ask your questions. You can unmute yourself and begin to ask your questions. Hello? You can unmute yourself and begin to ask your questions. Vicky, I can see you. You want to say something? Hello?
Hello, good morning.
Hello, good morning, Vicky. Is that Vicky?
Yes.
Okay, Vicky, what's your
yes.
question?
My name is Adenike Adesina, but I use Vicky on my platforms.
Okay.
I just joined today.
Okay.
My first class actually.
Good.
Although I've been coming for antenatal since March.
Okay.
So
when you're due very soon.
Okay.
So what's your question?
Yes. The question is on the episiotomy.
Okay.
When you talked about using tepid water.
Yes.
So the tepid water, I wanted to confirm, is just warm water and salt, you said?
Yes. You see, when I say tepid water, not cold water, but not warm, not hot water.
Hot.
Not hot water. Not even warm water. Tepid water is not cold water, but it's not warm water. It's in between. And you can either add salt or add Savlon, a little Savlon in it. It will, give you some soothing at the site of the episiotomy.
Okay.
All right.
So I wanted to ask also that the bathing for mothers after birth, the hot water bathing that people do. I don't know, for people that did episiotomy, is it advisable? Where they use very hot water to massage the stomach.
You see, that's why we are trying to discourage the use of hot water. You see, a week after the delivery of your baby, if you have episiotomy, avoid using hot water to massage your tummy. A week after the baby is born, when your episiotomy would have, healed, you can then begin to use hot water to massage your tummy. Because if that hot water trickles down to your below, under, it can cut the sutures that was used to suture your episiotomy. Can you hear me, Vicky?
Okay. Yes, ma. Thank you.
You're welcome.
Hello.
Okay. Hello.
Hello. Good morning, ma'am. Good morning, doctor.
Good morning.
Thank you. My name is Faith.
Yes, Faith?
My name is Faith. Yes,
okay,
ma'am.
Faith,
Thank you so much for the lecture. I joined late, but I think I got one or two things.
Okay, good.
So I have a question to ask. So I'm a patient at Mother and Child, and I went for my scan 2 weeks ago, and I was told that I had low-lying placenta.
Good.
So from this lecture today, is it possible for the placenta to change position before birth? And also, is it possible to still give birth normally, or it has to be CS? Because for like 2 weeks, I don't think I've had rest. I've been reading things on Google and stuff like that.
Okay.
So I just want to ask, I want to hear from, is it possible for me to give birth normally? And also, is it possible for the placenta to change? Because I was asked to avoid some things like bed rest. I should be on bed rest, and avoid sex and stuff like that. So I want to know, is it possible for the placenta position to change? The doctor. The doctor that did the scan.
Okay.
Yes.
Okay.
Yes.
Now, because it's low lying, it's not as bad as those types that are close to the cervix or lying on top of the cervix. So you could still have your baby normally.
Okay.
Yes.
Okay. Okay. But is it possible for the placenta to change from the low line? Is it possible to change position? Because I'm still at my 24th week.
24th week. Yes, sometimes, as the uterus increases in size, it can also shift a little. It can begin to shift a little. But not a major shift.
Okay.
Yeah.
Okay. All right. Thank you, ma'am.
You're welcome. Thank you for coming, joining us.
Hello. Good morning, Mrs.
Hello. Good morning.
Good morning, Mr. Adesina.
Good morning. Who am I speaking?
Can you hear me?
I can hear you.
I'm speaking with Kolade.
Kolade, Mrs. Kolade, you're welcome. Yeah. Thank you for joining us. What's your question?
Yeah. Okay, my question is totally out of the topic today.
You said what?
At my 39th week.
Okay.
My question is totally out of what you taught today.
It doesn't matter.
I'm currently at my 39th week.
Okay.
39th week, and I don't know. I read something about water leakage or water breaking outrightly.
Okay.
I just want to know what to check out for, how to know if my water is actually leaking. Or I know that if it breaks, it's supposed to be much, it's something that I will notice immediately. But when it's leaking, I may not be able to differentiate from the normal discharge.
Yes, you may not be able to know if it's leaking. But if you have a good sense of smell, you'll be able to differentiate. If you have ever smelled amniotic fluid before, if you know the smell, you will be able to
differentiate. I've never smelled it before.
So you won't know if it's slow leaking. You won't know.
So what do I do in that case?
You are 39 weeks. When your antenatal visit should now be weekly.
Yes, my next visit is on Tuesday.
Well, you know what to look for labor.
Yeah, my doctor already ran me through that.
What did your doctor tell you?
He told me that I'll begin to have a painful Braxton aches.
No, Braxton aches is not painful.
Yes, like it was his description that it may come like Braxton is, but it will now be
Okay,
painful. Like that means my tummy will be hard, but it will be painful, unlike normal Braxton is, and that it can start with 1 hour interval. Then if it begins to close up, then I should know that I should be getting ready to come to the hospital. And then the second one, it talks about muco, that I may be seeing muco with blood or without blood. Blood stain or without blood stain. That, but if it doesn't come with pain, I should still watch out. And then the third one, how did you even say? The third one is the water breakage.
Okay.
So then I went online. I saw the leakage myself. So sometimes I just see my panties wet. And then yeah.
Okay,
so
just if it's slow leaking, you won't be able to differentiate. But when you see mucus, that is your show. With that,
because the pain, I'm really not. I feel the pain, but I cannot even calculate it with the hours or the closing.
Are you having the pain right now?
I'm not, but I have it sometimes. But it's not something that comes the way you describe that. Okay, it may come in 1 hour interval or 30 minutes interval. It's not like that. I may just experience 2 in a day.
Okay.
Or maybe late at night when I'm about to sleep.
That is not it. Anyway, when is your next clinic?
Tuesday.
Just go on Tuesday and see your doctor. Thank you.
Hello.
Hello, good morning.
Hello, good morning.
Good morning, ma.
Is that Arietta?
Yes, Arietta speaking,
Okay,
please. Good morning.
Good morning. Thank you for joining us.
Thanks for the lecture.
You're welcome.
Yeah, please, from what you said about postpartum hemorrhage,
yes.
Are you saying that, or is it that people with multiple gestation, are they at higher risk of having postpartum hemorrhage?
Yes, they are at risk. 3, 4 children, 2 babies. Sometimes, not all the time, but they are at risk.
So how do one prevent it?
Once you are in labor, you go to the hospital. You are not actually prevent it. It's your caregiver that will ensure that after your delivery, you don't have postpartum hemorrhage. There are things we do to prevent it at delivery.
Okay.
Yes.
Okay. All right. Okay. That's what I wanted to find out. And then, sorry, another thing, I want to find out. I did cervical cycling. Okay. So, and then I was advised that I was told to avoid so many things. And one of them is to go off sex for a while. As in, is it throughout the pregnancy period now? Or just for a while?
You know, for the time being, how old is your pregnancy now?
18 weeks.
13 weeks.
18 weeks.
18 weeks. My dear.
Yes.
Stay off for now. Okay. By the time you are ready to start, your doctor will tell you. But for now, it's still young. The pregnancy is still young and it's still at risk.
Okay.
So stay off. Yes, stay off.
All right. Thank you very much.
You're welcome.
All right.
Good morning, ma.
Good morning, Uche.
Thank you for the lecture. I learned a lot.
You're welcome.
But I actually have this episiotomy gives me a lot of anxiety. Like, it really gets me really, really scared. And okay, I have a friend who gave birth in the UK, and she told me they didn't give her episiotomy, and after birth she was given a stool softener. So going to the toilet was not an issue for her at all. So I also want to find out, is it possible, because according to her, she was given a massage. She said her cervix was massaged, and with that, it really helped with the labor. So she didn't really need that episiotomy, although her baby was big. So I want to find out, do mother and child give stool softener, and do they also give them massage? And another thing too, I want to also find out if a patient seeks for a tour, hospital tour, like a tour to the labor room, do you allow that? Because I really want to feel comfortable. This is my first child, and I really have a lot of things going on in my head, a lot of things that scares me right now.
Yes, yes. You can have a tour around the hospital, especially to the labor room suite.
Okay.
You can. But as per the giving of episiotomy, that your friend was just massage and she didn't have episiotomy. See,
yeah.
Naturally, there are some women that have their birth canal adequate enough. They have enough room. No matter the size of the baby coming, the baby will pass. But there are some that they are so tight that if you don't help them with episiotomy, then they will injure themselves and injure the baby. So the giving of episiotomy is to help the mother and help the baby. When they need it is when we give it. When they don't need it, we don't give it.
Okay. All right, ma. Thank you.
You're welcome.
Hello, ma. Good morning.
Hello, good morning, Chinasa.
Okay, ma, thanks so much for the lecture. Like I said, today is my first time of joining.
Good.
So I want to know, how do we catch up with the previous lectures?
Yes, on the YouTube, you can catch up.
Okay.
Just go to Mother and Child and you catch up with it.
Okay.
Thank you.
Good morning. Yes.
My name is Ayomiko. I have a question. So for a mother that gets episiotomy and already took an epidural, I know that usually after the baby is born, they sew up the mother. So I wanted to find out if the epidural lasts through this process, or by then it would have worn off and then the mother now feels the pain.
No, the mother will not feel the pain. If you have epidural, at different intervals, more injections are injected into the tube so that you still don't have the pain. You understand? So by the time your baby is out, placenta is out, and the episiotomy is being repaired, you still will not feel the pain. In fact, much more after, you will still not feel the pain. By the time you start feeling the pain, maybe second day or third day, you will be given some tablets that will relieve the pain.
Thank you very much.
You're welcome.
Hello, ma.
Hello, Vicky.
It's Miss Adedokun. Yes, Mrs. Adedokun. Yes, ma. I forgot to ask the other time for PPH. I wanted to ask, is there a name for the normal placing of placenta? Because
is that what?
A name for when the placenta is normally placed, and where is it supposed to be? Because when you were talking about the three types, you talked about the underlying and the one, you understand, different
the low
ones.
lying and the
low lining and all. So if you don't have that PPH, if you don't have
any
the
of the
placenta,
previa,
yes, where should it be? Because the last scan I did was when I was at week 20, and I there was nothing said about placenta. I'm at my 33rd week right now, and I've not heard, there's not been anything said about where the placenta is being placed.
Yes, I'm sure that if you look at your scan report, you will see the position of the placenta. I'm sure there is no problem. That's why it was not discussed with you. Usually, it is not discussed if everything is well. They will just write, your sonographer will just write in your scan result form that placenta normal. The only time you will raise attention is when it is abnormally placed.
Okay, ma'am. So at the scan that I had at week 20, it should have been written there that the placenta is placed.
Yes.
Okay. Thank you, ma'am.
You're welcome. we have more questions coming?
Yes, ma'am.
Uche.
Yes, ma'am. I just remembered there's a question about epidural I've been wanting to ask.
Okay.
With epidural, is it like a 50-50% success in terms of side effects? Because my sister-in-law had epidural, and I can't really explain what went wrong along the line. And since after that period, she's been having a particular kind of headache that like nothing stops it, even after taking Panadol extra and all. So I want to know, is it like a 50-50 thing with things going wrong like after?
Is it your blood sister or somebody close to you?
Yeah, somebody close to me, my sister-in-law actually.
Do you know whether she's been having this type of headache before the epidural? It's possible.
No, she wasn't. She confirmed it that she wasn't.
That she wasn't. Okay.
Yes. So I want to know, with epidural, is there 50% probability of you having side effects?
Actually, epidural is very, very safe. You know, like every other thing, you will always have just one, maybe 1% out of 100, one may end up with a complication or the other. But I can assure you that epidural is very, very safe without any side effect.
Okay.
Yeah.
All right. And one more thing, ma'am. Sorry. When I was doing research concerning epidural, I also saw that there's one in form of gas, in a gas form that they give. I don't know if you can throw more light on that one, and if you also offer
Come again, please.
During my research for epidural,
yeah,
I found out that there's a kind of pain, should I call it a pain relief they give in form of gas?
Gas.
Yeah.
You put on your face, in your nostrils?
I think so. I don't really know how it's administered, but I know it's in a form of gas that they give to the patient. So it kind of like eases the pain instead of the normal injection that they would give.
Yes.
That's not in Nigeria, right? Hello?
This is Dr. Larry Matron.
Yes, sir.
Now, well done. Can I help you out there?
Please do, sir.
Okay, yes. Good day, I say good morning, everybody.
Good morning, sir.
Thank you for the listening audience and the very able lectures we have received. Now, I want to just expatiate a little bit about pain relief in labor that Matron talked about. You see, there are different methods to relieve pain. You can have injection, not necessarily epidural. The problem with that is that some of these things that will relieve, the drugs that will relieve pain, will make the mother to be drowsy, and it can cause the baby also to be sleeping. Therefore, we don't use that too much now. And they are not something you can use for a long time. Secondly, we have the gas that the lady is talking about, and that's nitrous oxide, what some people call laughing gas.
Laughing gas.
Yes, there's nitrous oxide that you can use. It's packaged, and the name is what they call Entonox. But that thing is not being manufactured much now, because some people use this gas as explosive materials. Therefore, it's not being produced now, except under very, very, special conditions. We don't have it to be used widely because of these problems with explosives and all these terrorists. We are not manufacturing it now, but there is a gas. You can give it as a face mask. The mother will put it in the mouth, breathe in, and when she feels drowsy, the pack will fall off her hand, and she will sleep a little bit, and then wake up again when there's pain, and inhale it again. Therefore, there's Entonos. But the one that is a little bit common now, and we have, is that epidural. The epidural. Yes, the one lady asked about a headache also. There is nothing that we do in medicine generally, because there is nothing that is 100% perfect in human affairs. Also, when some people take epidural, they can complain of headache. But as the matron asked, maybe this woman has been having some of this headache before she had the epidural. That's why we have to take, it has to be done by those who are trained to do it. It has to be done under very aseptic conditions, sterile conditions. It has to be done by those anesthetists. In fact, it's not gynecologists who do it. If you observe all the precautions and it's done properly, the complications are rare, but there are complications. Thank you very much.
Thank you, sir.
Thank you, sir.
Yeah, I have a question.
Let me talk, by.
Yes, ma'am. It's about hemorrhoid, right? I think that's what it's called. That's swelling.
Yes, adenos.
Yes. So, like, why do people have it, and then how can we relieve it, particularly during and after labor?
Maybe I can ask, I can help the matron here. Now, people have hemorrhoid because of the pressure that is applied to that part when one is pregnant. One, there are pressures probably of the baby's head or the mass in the lower abdomen. And don't let us forget that the uterus is actually in front of the rectum. Therefore, there's a pressure there. There are a lot of pressure that is applied to the pelvis. The second thing is that a lot of blood is going to that part of the body when you are pregnant. And all the tissues of the body are relaxed. They are not as hard as they are when you are not pregnant. And this one includes the anus also. Therefore, sometimes this hemorrhoid develops because of the relaxation and the softness of the tissues in the anal region and the pelvis in general. And then because of the blood that is flowing there and makes everything to be relaxed. And then secondly, because of the pressure of the head that is applied to it, especially late in pregnancy. What to do is to prevent blood stool being hard. You know, if the stool is not hard, it's not going to cause much pain and problem. And what you have to do in that case is you drink a lot of water, take a lot of vegetable, take fruits, and don't wait until stool is very hard before you pass it out. And then we can use some pain relief, really is mild pain. You can take some pain relief. Sometimes we give paracetamol. Or if it's becoming more painful and disabling, you can put some, you use some local things on the rectum and on the anus to relieve the pain and to reduce the swelling. Sometimes we use things that contain local anesthetics like xylocaine, or things that will make the stool to come out easily, like anus or protrusidia and things like that. Therefore, there are ways that if you discuss with your doctor, they will find a way to help you out. Thank you.
Thank you, Andy. Hello, anybody? Shadrach.
Okay, my question is, can you hear me, ma'am?
Yes, I can hear you.
Okay, my question is on the uterine contraction after delivery. So, for someone who has a C-section, what can you do? Because I have a sister-in-law that told me to get that abroad.
Sorry, I can't hear you again.
Oh, okay, can you hear me, ma'am?
All right, I can hear you now.
Okay, so I said about the uterus contraction after delivery.
Okay.
So for a C-section, I asked a sister who said when she delivered abroad that they put this banding band on her tummy immediately after. So I'm asking, what can we do? You said something about hot water, but for the vaginal disease. Asking, what can we do if you have a C-section?
Normally, after your delivery, your uterus continue to contract, especially when you breastfeed. That's why we encourage breastfeeding after delivery. When you breastfeed, your uterus will continue to contract. So, well, that's why some patient, some mothers will tell us that when they breastfeed, they feel in pain in their tummy. We tell them that it is okay, but they will be given something to relieve the pain. But we tell them to continue to breastfeed so that the uterus will continue to contract until it gets to the size it should return to after delivery. Can you hear me?
Okay. Yes, I can hear you.
All right.
But I still feel it's not very effective. If we can we still use hot water to press the tongue?
Yeah, well, you can use it, but you know, if you have episiotomy, we say you should wait a week after before you start using hot water. But you see, I always tell mothers that your uterus that takes 9 months to grow up to the size it is when you deliver, we also reduce gradually. If you not go back to the size, to that size you desire in 1 week or in 1 day. So it takes time, but it will eventually go back to normal.
Okay, thank you very much, ma'am.
You're welcome, Shedra. Hello?
Hello, ma. How about for people that go through C-sections? How
I can't hear you.
do they get their stomach to go?
Hello?
For people who have C-section. Hello, ma. Can you hear me?
I can hear you now.
People go do C-sections. How does their stomach return back to normal? Since they won't be able to use hot water.
Yes, the same process we talked about. The same process we talked about. Breastfeed. When you breastfeed, your uterus will continue to contract until it goes back to the normal size.
Okay, but I think the other lady was trying to ask that somebody who had a C-section used a belt, some sort of belt.
Yeah, there is sometimes ago in Mother and Child, a woman came and was selling afterbirth girdle. It's like a pant that you wear, and it helps to lift up your maybe a bulging tummy and help you to stay firm on your abdominal wall. But we've not seen her again for some time. That could also help. So if you can get a afterbirth girdle, it can help.
Okay. Thank you.
Hello? Anybody with any question again? In the absence of...
Hello, good morning. Yeah, hello.
Yes, good morning.
So sorry, I just joined not quite long ago, but from the topic that was sent to us, I'd like to ask a question.
Please do.
Surrounding episiotomy. So my question is this: is it compulsory? Like, is it a must that a first-time mom must surely have an episiotomy, or is it subject to the size of the baby? For episiotomy to happen.
Okay, you see, because a first-time mom has not tried that birth canal before, you cannot determine, you cannot decide whether you want it or not. Because by the time your baby is coming, it is your your caregiver that will know whether you will need the episiotomy or not. But I can assure you that before episiotomy is given, usually we try to fill the birth canal when what we feel shows us that this baby can come through this place without creating a room for it. We allow the woman to deliver the baby without episiotomy. But if we sense that the place is tight and we can help by giving episiotomy, we sure will tell you and we'll give you the episiotomy. Okay. Because if you don't do it, you are creating stress for the baby that is coming, especially the head. You know, you don't want to give the baby that is coming with the head, you don't want to create problem for that baby.
Okay.
What's happening now?
Hello?
Hello, Sunny. Hello?
Olamide.
Okay, Olamide.
Well done, ma.
You're
To
welcome.
suture the episiotomy back, are you going to numb the place? The caregiver, are they going to numb the place?
Yes. Yes, you see, before that baby comes, even before we give the episiotomy, we'll give you an injection in that place. And by the time your baby comes out, yes, by the time your baby comes out, that injection that was given you would have started working and creating a numb sensation around that place. So that when we are giving the suturing the episiotomy, you will not feel the pain. Hello? Hello?
Oh, okay.
Hello.
Hello?
Hello, good afternoon.
Good afternoon.
Yes, ma. Thank you very much for the informative class. I just wanted to ask a question on the point that you just mentioned a few minutes back on the GEDO after a cesarean section.
Yes.
At what point can you start using, the belts and GEDO after the surgery, please?
After the surgery, yes. Once your wound has healed and you are discharged, you can use the girdle, the pant girdle, yes.
Okay, just the pant girdle, because a discharge is usually like after 4 days or something. So is it advisable to start?
Not immediately, not that kind of discharge. I mean, maybe like the wound has healed completely and maybe 2-3 weeks after, you can wear.
Come to the clinic. Excuse me, please. Can I just contribute a little bit?
Yes, sir.
Yes, please.
Okay.
2 things about the episiotomy. That lady asked if it's. I want to say that episiotomy is not for everybody. It's not compulsory that it must be for every firstborn must have it. It depends, as she said, it depends on the size of the baby and the relaxation of the vagina. If the place is relaxed well and it can allow the baby to come out, that's very good. But more often than not, because of the tough skin of the first delivery, it's most of it's invariable that one will get episiotomy. But if the baby is small and the vagina is capacious, is open enough, then there will be no need. And then just as Matron says, usually you have to numb the place before they come. Because they can, even before they suture, if you see pain, you let them know so that they will put more anesthetic agents in that place. Now, when do we start to make ourselves, our tummy firm after delivery? Whether it's CS or normal delivery, everybody wants their tummy to be back. But usually we don't advise you using GEDU until you have come to clinic 6 weeks after delivery, especially for CS. Make sure that you come and the doctor sees you and the wound is fully healed and you are strong, and your tummy is strong enough to take those GEDUs, because sometimes they come and you find out the woman can hardly breathe when they come to you with those GEDUs. Therefore, please make sure that the doctor certify you completely healed before you use it. And even in normal delivery, it is not the GEDU that you use immediately after you deliver that makes the tummy to go back. Matron has said, let the uterus involute first, and that one can be held by baby breastfeeding well. Then you can combine it with abdominal exercise. Breathe well, let the womb involute. Get to the clinic, let them tell you that you are okay before you start to put anything there, please. I've seen many women They say they are going to for massage, or they are pressing their tummy. We don't advise that. People have come with a lot of complications, ruptured spleen, ruptured liver, when they are trying to press the abdomen after delivery. Please don't engage in things like that immediately. Let the doctor see you. Fortify yourself, please, before you do anything. Thank you very much.
Thank you.
Thank you, sir.
Welcome, Max.
Hello, anybody again?
Hello.
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 Yes. Yes. Good morning, ma.
Good morning.
Okay, just like what the doctor just said now. So it's not advisable because we in Africa, when we give birth, immediately we get home, we have either mother-in-law, sister, or whosoever will start pressing your tummy with hot water. Is that one okay, or we should still wait? Because most times if you don't do it, there will be like your tummy won't go back to normal, your womb and etc. won't go back to normal.
Usually, please, things like that is very dicey at times, especially for our mommies at home. And when it comes to childbirth, it's very, very emotional. But we need to be careful. Those hot water, sometimes I've seen people get burned. And as I said, I've had to operate on women that have their spleen ruptured when they are pressing that thing at home.
Yes.
Yeah.
Wow.
Therefore, we need to be very, very careful of things that they will just go. Even some people, they will tell you to drink alcohol so that bad blood will come out. All those genes, is just alcohol. It makes the womb not to contract well. That's why you are bleeding. You are now losing your blood. So it's not advisable. Those things, if you try contraction, and therefore your uterus will not evolve well, and you will be bleeding, and they will think it's bad blood that is coming out.
Okay. All right. Thank you very much, sir.
I usually ask some of our mothers, I tell them when they come to the clinic, some of us, we have gone to school and we know what we are saying scientifically. If they can tell me the school where they learned it from, or who told them those things work. Therefore, please, you can drink hot water, you can let your baby suck well, relax yourself very well, keep yourself neat. The womb will be involuting. It is not those pressure that keeps the womb from going down. It is not.
Okay.
Thank you.
Thank you very much.
But
Thank you
now,
very much.
after you are healed, you can now go for abdominal exercise.
Okay.
To relax, to now firm the muscle. See, all those muscles that that seem to be excess is because of the distension of the womb. By the time the womb has involuted, that's 6 weeks after you are delivered. By the time the womb has involuted, you can now go for abdominal exercise to firm off your muscle, to firm off your tissue. In that case, the womb has gone down, and those people who will tell you about this exercise know what they are talking about also. It's not somebody who will just stand on you and be pressing your tummy and doesn't know what is pressing. Thank you very much.
Thank you, sir. Thank you, sir. Thank you.
Thank you very much.
Thank you, MD. Well, do we still have questions? I think in the absence of any other questions,
let's call it a day.
And we call it a day.
Matron, thank you very much.
For coming. You are
thank
welcome.
You for listening.
Thank you for assisting us. Thank you. All right. See you in another fortnight. Bye.
All right. Thank you very much.
All right. Thank you very much.
Bye.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.